Hey, Alex. My
Hey.
name is Sarah. Sorry, no, it's not good to shake with your left hand. I'm your occupational therapist. I know that you were referred to me by your doctor since you just had carpal tunnel surgery. Is everything been going okay since the surgery?
Yeah, it's going pretty good. I just have a little bit of like tingling, and sometimes it feels like paresthesia. I know it's
Okay.
not, but it just feels kind of weird.
Okay, that is normal for a little bit, but I'll give you some exercises that you can work on.
Okay.
So I'm just gonna go over a few things. Can you tell me your birthday?
Yeah, it's 1/8/96.
Okay. So you had it on your right wrist. Did you have carpal tunnel before? Like how long ago do you think you had it?
I don't know. Probably maybe like 3 years ago.
3 years,
But
okay.
I didn't really think it was carpal tunnel.
Yeah. Do you have like a job that like you use it all like typing?
Yeah,
or-
so I actually work at the front desk at a gym.
Okay.
I do have to type a lot, which it kind of hurts
Okay.
sometimes, and I also have to do a lot of like filing paperwork.
Yeah,
and
yeah.
sometimes it can mess me up just because it hurts so much.
Yeah, kind of get like tingling.
Yeah.
Are you a student or anything?
Yeah, I am a student.
Okay, so you have to type a lot then.
Yeah.
Okay. Do you have any like past medical history, like high blood pressure?
Yeah, I used to have high blood pressure. I actually
Okay.
had a tumor removed on top of my kidney. And
Oh, okay.
Yeah.
Wow. Okay. Did you receive any prior OT services when you were having carpal tunnel issues?
No, not really, because I just never thought about it.
Okay. So I know that the doctor gave you a couple precautions since you had it, like you can't flex or extend your wrist,
Mhm.
and you also know not to pinch or grasp or like lift anything, right?
Yeah.
Okay. So can you tell me a little bit about your living situation? Do you like live at home or like in an apartment?
Yeah, so right now I just live in an apartment. I do have a roommate.
A roommate, okay.
Yeah, it's all on like one story.
Oh,
So
that's nice. Okay. So right now I'm just gonna ask you a few questions about like your range of motion, just to see about your fingers. Since we can't really check on the wrist, I'm just gonna see about your fingers and then also like your elbow. So like above and below.
Okay.
I'm gonna take this off because you can't really move it with your splint. Oops, sorry.
You're fine.
Make you lose a thumb. This is the first time you've had your dressing off too since surgery, right?
Yes.
Okay. Okay. There's a little redness and some swelling, but we'll talk about that.
Okay.
Can you just put your like kind of elbow up and can you grab? Okay. Is there any like stiffness a little?
It's not. Yeah, it's kind of stiff, but it's
Okay.
like not so bad.
Okay. Can you? I see with your left hand how you do it. Okay. Perfect. Okay. With your elbow, what I'm gonna have you do is I'm just gonna have you see if you can extend it all the way out. Okay. Any pain or anything?
No, not
Okay.
really.
Can I see you do it with your left hand too?
Yeah. I guess I can do it faster with my left hand, so it's not really pain. It's just kind of like slacking.
Slacking. Okay.
Yeah.
Okay. We will work on that. So since you have some swelling still, it's pretty normal, but what you always want to do is keep it elevated, and then we want to still ice it, but absolutely do not put heat on it because heat will just increase the swelling.
Okay.
And I'll give you a handout with all this over it.
Okay.
I'm just going to ask you a few questions about like some activities you did at home before you had surgery. And if you can just tell me if you were independent or if you needed some help.
Okay.
So how about feeding? Did you need help before?
No, yeah, I was pretty independent.
Okay. What about bathing?
I'm independent.
Okay. Grooming?
Independent.
Okay. Upper body dressing?
Independent.
Okay. Lower body dressing?
Independent.
What about toileting?
Independent.
Okay. Meal prep?
Independent.
Okay. And homemaking skills such as like cleaning or like making your bed and stuff.
Okay, yeah, independent.
Okay. Now I'm just gonna ask you what your status is since you've had surgery. So ranging from a 7 to a 1, 7 independent and 1 is like you need total help.
Yeah.
Okay. What about feeding?
I can do it pretty independent.
Okay. What about bathing?
Sometimes I might need a little bit of help.
Okay.
Trying to like put the shampoo in my hair.
Yeah. That's really. What I recommend for that is the bottle of shampoos that have like the pump. That way you can like pump it with one hand.
Okay.
What about grooming?
Grooming, I don't really need help, but sometimes I get a little fatigued.
Yeah, okay. What about upper body dressing?
I'm pretty good with that.
Okay, independent. What about lower body?
I'm pretty independent.
Okay. Toileting?
I'm pretty good with it.
Okay. Meal prep?
Independent.
Okay. And homemaking skills?
Sometimes I might feel a little fatigued again.
Okay. Alrighty. So, since you came to OT, I know that you're wanting to kind of get back to work and to be able to do your student tasks, such as like typing and stuff. What are some goals that you really want to focus on?
I guess, increase the full range of motion again in
Okay.
my hand. And, being able, I guess, to grasp and to like stretch out my hand and to not be as like fatigued when I'm trying to perform activities.
Okay. What about just like being able to keep your incision clean? So
Oh,
no
yeah, for
infection?
sure.
Okay. Yeah, and OT will work on being able to keep your wound clean, and then some nerve gliding exercises, since we can't really go into the strengthening and range of motion of your wrist right now until your stitches come out. Right now we'll just focus on kind of splinting, like when to wear it, when not to wear it, and I'll give you some nerve gliding exercises, but after you get the stitches out, then we'll be able to move into more of the range of motion and then the strengthening. It's just a process, so gotta trust the process. Do you have any problems right now, like sleeping or anything?
Maybe sleeping. There's a little discomfort sometimes.
Okay. We will, I'll show you a good way to sleep.
Okay.
And then it should help you.
Okay.
Also, I know that you do have swelling and it will continue over time, but we really want to keep that down. What is really important is for you to ice it every hour, every other hour for at least 10 to 15 minutes, but make sure you place like a paper or like a towel down so it's not just directly on there.
Gotcha.
But again, no heat.
Okay.
And you also want to keep it elevated. Don't like let it swing down to your side. And then since you really haven't been able to take a shower, this is like the first day you'll be able to take a shower. What I want you to do is to wrap your splint in a plastic bag so it doesn't get wet. And your roommate might have to help you like tape it or anything. But it's also important if you get your splint wet to change it immediately. Okay, Alex, since you don't have the splint on right now, we're gonna practice putting it on in a minute.
Okay.
While it's off, this is the only time you're gonna take off your splint, but we're gonna work on some nerve gliding exercises. So I have them on my computer right now. I'll print this off for you. Our printer is just not working at the moment. But do you see these right here?
Yeah.
That's just what we're gonna do. So we're gonna practice them right now and just make sure you don't flex or extend the wrist.
Okay.
So you're gonna this, in, out, down, and thumb in. Can you do that again for me?
Yeah.
You can, yeah. Okay, good job. You're gonna wanna do this 10 times, like a set of 10, and you're gonna wanna do it 5 times a day.
Okay.
Okay. So now, since we did that, I'm gonna see if you can wrap the splint again for me.
Okay.
And then, okay, we'll put this on. So just remember to always keep it dry, and if it does get wet, to change it immediately so you don't get an infection.
Okay.
Now I'll go in between here. Okay. Okay. Do you have any questions about that?
No, I don't.
Okay. So I'm gonna recommend that you come to therapy 2 times a week, and then we're gonna probably do it for 6 weeks. That way, it gives you time to get your stitches out, and then after your stitches out, we'll be able to do the range of motion and strengthening.
Okay.
Okay. Thank you so much.
Thank you.
So I know you've been saying you have a little trouble sleeping. I'm really bad about sleeping on my stomach, and so I always put my arm under there, but that's something you don't really want to do. So I'm just gonna have you lay down here,
Okay.
and then I'm gonna have you scoot over a little if you can, sorry. Okay. And so what I want you to do is like when you're laying here, if you can, I would prefer if you like would lay it like this, so it's not like hanging down or anything like that. Is that comfortable?
Mm-hmm.
Okay.
Yeah.
It does take a little bit getting used to, but that'll really help you and probably you'll be able to sleep more.
Okay.
Is there any other questions?
No, that's it. Thank you.
Perfect.